Hi everyone, I just wanted to show you what a treatment would look like for someone who's having some upper back pain. So we have Kim here today. Right now she's just got some moist heat on and doing a little EMS, which I don't really do all the time, but it helps her loosen up and feels pretty good, so we'll do it on her here and there. She's got some pain here in the upper thoracic, lower cervical region. So that's going to be sort of right at the base of your neck. She has pain that's coming from some of these facet joints, which are the joints in the back of the spine. So not a disc problem for her. She does have some cervical instability, so we're not going to be adjusting her neck at all, but we are going to treat through her middle thoracic spine just to get some more motion into those joints, and we'll show you that after she gets off the therapy. Then we're going to do a little needling, and we're going to do a little bit of Graston and show a couple exercises that you can try at home if you're dealing with something like this. So she's off of stim and heat, and now I'm just going to use the Hypervolt for a little bit. It's just a percussion massage gun. It's just going to kind of loosen her up a little bit, make it easier for her to adjust. It's not really going to make a whole lot of long-lasting changes, but it feels pretty good and helps loosen the area up. And let's have you go ahead and flip over for me, Kim. So we're gonna do a thoracic adjustment here. I'm gonna have her go, let's go all the way face up for me. So with this, it helps me get some more mobility and movement into her middle back. So kind of between the shoulder blades, a little bit lower, and just helps with her thoracic extension. So what I'm gonna do is just roll her a tiny bit. We're gonna cup up underneath this area, right here, and then big breath for me. Good, and then we're gonna go a little bit higher. One more here.
This is as loud as it gets.
So a little bit of movement in there. She doesn't have a ton of extension limitations, but it does help her work into that extension with some of the exercises too. So we did some manipulation in her middle back with the heat and just the therapy before to kind of loosen her up. So what we typically do for her during this acute episode too, she gets a lot of tightness through her upper traps or middle traps and a muscle called the levator scapula, which goes from the corner of the scap up into the neck. So I'll do a couple needles and just hit a couple trigger points in our upper trapezius with some dry needling. So I'll go ahead and show you that quick. If you want to come over here, Dr. Bree. So usually has some tenderness right here in her upper trap. There's a really common trigger point in here, also called an acupuncture point. That's gallbladder 21, and we'll go ahead right in here. And you can see a little bit of a twitch there and a little jump. And if it's tender in here, it can be a little bit sensitive, but dry needling is not really inherently painful. And when we get that trigger point reaction, that's a unique sign of a trigger point. So it's telling us kind of that we're in the right spot. And I won't do a ton of needling on her today just because I think really for her recovery, it's gonna take just consistent exercises working on strengthening her middle trap area, her rhomboid area, just to kind of bring her shoulders back, get some good scapular stabilization type stuff, and just kind of bring her head back over the top of her spine. When you work at the computer, or sorry, I have my dog here today, or you're working in front of you at a desk a lot of times, what happens is we get this kind of upper cross syndrome pattern where our shoulders roll forward, our head sits a little bit forward, and people get a lot of tension on their neck. So if you want to come around that side, Dr. Bree, and shoot it from that way, that'd be better. We're just gonna pull her arm off here. We're gonna do that same spot here on the left side. It feels a lot better over here. Most of her discomfort is kind of on the right upper back there, But typically when I needle, I'm gonna needle both of these upper traps and see if we can release this a little bit on both sides. How does that feel, Kim?
Good.
A little bit sensitive, a lot of jumping. She's been feeling pretty good. We've been doing some needling, really heavy emphasis on home exercise and some chiropractic adjustments too. And it's really helped her through a tough time here. Also with some at-home cervical traction, which I don't recommend a lot, but has really helped her. So we're gonna do a little GT. It's called Graston technique. It's just a myofascial release, helps you kind of work through the fascia a little bit and some of the muscles, bring some blood flow to the area. So the emollient is just coconut oil with some beeswax and some other oils. And I'm gonna go ahead and work at an angle here, right through this kind of CT junction and the paraspinal muscles. So the ones that go between the segments in your spine, and typically feels pretty good. I'm gonna stay away from the areas where I needle, just because I don't want to throw too much at that area in one visit. We're really doing a lot of treatment on her today, but I just want to show you guys a good idea of some of the things that chiropractors can do, including adjustments, but also other therapies besides adjustments that either a chiropractor or a physical therapist can do to help you with these sort of complaints when you are trying to get relief without having to take medications or go the surgical route. So she has not had an MRI just because it wasn't indicated. Usually we want to try around 8 weeks of treatment before we think about getting an MRI, unless there's any red flag signs. So a red flag sign would be if she is having like arm weakness, or if she's having some upper motor neuron signs, like the reflexes aren't normal, or some of those neurologic tests look a little bit different, then that's an indication where I'm going to say, you know, this patient might not be right for conservative care right now. I think we need to get an MRI and look and know exactly what's going on with the spinal cord and the nerve roots and just the vertebra around that area, and make sure that we get the patient to the right provider for the right treatment. And luckily she's done really well with the care that we've been giving her, and we haven't had to go that route. The last thing that we're going to run her through here are a couple exercises. She's already been working on these at home, so slow this down a little bit. The first one's a low row. So the most important thing here is bringing these shoulder blades back and down. So we don't want to see her hunch up a lot here. We want to see the shoulder blades move towards the spine and down a bit. So go ahead and lock those in. Good. And then she's going to keep her arms straight, and she's going to pull this band right down next to her hips. Keep it right by her hips. And keep these shoulder blades locked in. So working on the scapular stabilization and trying to create some balance between the upper traps here and the lower and middle traps and the rhomboids. Okay, and then we're gonna pop this band off, and we're gonna do another scap stabilization exercise, which is working the shoulders with the external rotation with the scaps locked in that same position. So go ahead and grab the bands here with your palms up. Keep your elbows right by your side for me. Go ahead and come around here, Dr. Brady, and I'm gonna show everybody what it looks like here with her scaps. So bring these back and down right in here. So we wanna feel these middle lower trap muscles firing along with the rhomboids here. So she's locked in here. Keep your elbows at your side and go ahead and just externally rotate with the band. Keep your arms bent. Good, and you can kind of see these pop out a little bit, and that's because these muscles are working and we're getting these scaps kind of used to that position that we want, where they're back instead of rolled forward and out with a lot of upper trap dominance. There's a lot of other stuff you can do. You can hit the foam roller, you can use the lacrosse ball to work in that area. You can even do a lot of stuff with kettlebells that I'll show you at a later time, but These are some really easy ones that you can do at home just to get this activated and working, and it does help a lot with pain relief as well as the stabilization of this area.